Well, when we first heard about coronavirus and stay-at-home orders, many of us thought it would maybe last a few months. But now, with stricter rules in place again here in Allegheny County and some other areas, that initial timeline seems to be changing.
Yeah, we were all hoping by summer, right, that we
Right.
would be out of that. And who's getting the virus is also changing too, and so is what we know about it. So we're turning to a top doc at AHN, Dr. Arvind Venkat, who we've talked to before, to get the latest information that we need. David had a chance to ask him where we stand now and what to expect next.
Doctor, the spike that we're seeing now in our area, is that because people are traveling, socializing, or is it just sort of the normal course of this virus?
I think as Allegheny County opened, there are a sense that this was over, and unfortunately it clearly isn't. And all the public health experts are saying that even as we relax restrictions, we still need to practice social distancing and wearing a mask. Unfortunately, we weren't all doing that, and so the case counts have gone up.
And you were saying that here in our area, we have a chance to change this. People in states like Arizona or Texas, they're in a different situation.
That's correct. In Arizona and Texas, and Florida, we're seeing thousands of cases a day. When we get to that point, it's very hard to stop this without really severe restrictions. Here in Allegheny County, we are in the 100 to 200 cases a day range. That means that it is very much in our hands as to whether we stop this from becoming that level as what exists in Arizona and Texas. And the way to do that is to wear masks, practice social distancing, avoiding large crowds, and being very careful about hand washing and not touching your face and eyes.
You know, in the beginning, I think a lot of us thought, well, maybe we'll have to deal with this sort of thing for a couple of months. Now I think the picture is a little bigger than that. How long do you think this will last? That we're going to be talking about coronavirus and actively trying to keep people safe?
I think until we have a vaccine that is definitive, which means that it will provide immunity, or, and this is not the way to go, there are so many people who have had the disease that there's what we call herd immunity. We are going to be dealing with this. The fact that we're seeing cases in warm weather climates during the summer means that this is different. This is not a seasonal virus like the flu. That means that it's going to persist, and that means that it's really up to us to control it. It's not going to control itself.
And when you talk about vaccines, is it likely that the first vaccine that comes to market will actually 100% keep you from getting it? Or is this sort of a process where maybe the first vaccine doesn't do a fantastic job, but it's better than nothing?
So it really depends on how lucky we get with all the work that's being done on vaccines now. I think if we had a vaccine that was partially effective, we would take it because it's a way to protect us to some degree. The hope, obviously, is that we have a full vaccine that gives us 100% immunity. And remember that a lot of vaccines require more than one injection. I mean, if you have kids, you know that you have a whole vaccine series. That means that it's very likely for something like this, you might have to have a series of vaccines to have full immunity.
Talk to us about how the patients are changing, the age of the patients are changing. You're seeing younger people, and it also seems that there are fewer deaths to report, right?
So because the cases have come about from people relaxing in their social distancing, it's, I think, understandable that younger people are having this disease now more than the elderly who may have had it originally. I think those who are older are still very conscious of practicing social distancing. So we're definitely seeing patients who are younger. That means that they may be less likely to get severe disease, but we shouldn't relax on that because, first of all, young people can get severely ill. There was a case in Florida yesterday where an 11-year-old tragically died. So we need to understand that young people can get very sick as well, and young people can infect older people, and so you end up getting more severe illness as time goes on.
Talk to us about touching surfaces. I mean, in the beginning of all this, we talked with you about, disinfecting things, taking your shoes off, that sort of stuff. Now it seems like we talk more about the masks and this being transmitted airborne. Do we still need to be as cautious about like getting delivery into the house or something that UPS or Amazon delivers?
I think we still have to be careful, but the main mode of transmission is somewhat close contact with droplets, which means that when I speak or if I accidentally spit, and if it gets into your nose or your mouth or your eyes, That's how the disease is going to transmit, far more than I pick up a package that was delivered to my house and there might be some virus particles on the surface. That I'm sure can happen, but it's not a major way that this disease is transmitting.
And how important is it just to be outside? Like right now, because we're outside, that sort of adds an air filter to everything, right?
So the best evidence we have is that this disease is harder to transmit outside than inside. I don't think that just because you're outside, you can be in a large crowd. I think that you still need to practice social distancing, but we're in the summer, everybody wants to get outside. I think that's a healthy thing to do, and frankly, it's easier to social distance outside than it is in an indoor environment.
All right, we'll end it on that. Thank you so much, Doctor. We appreciate it.
Thank you. Stay safe.
Yeah, we do appreciate it. And,
Yeah.
you know, one of the things that he really stressed was these states that are seeing this, the spike in the South, you know, Florida, Texas, Arizona, we're not in that situation. We have the power to change things here just by following the rules.
Right.
Yeah.
It is interesting, you know, things are changing because this is new, right? So there are new things coming out every day that we're learning more and more about it as they work to get that vaccine.
Yeah.
So we'll keep watching that. And as always, we want to thank Dr. Venkit, who we've talked to here on PTL, and we enjoy his company. He's emergency medicine specialist at AHN.